All right, we're just going to give people a few more seconds to log on and get settled. Happy New Year.
Happy New Year to you.
This is our first webinar of the year.
Here
This is very exciting.
This is exciting.
Did you make any resolutions?
Um, this year I've been saying I'm making goals, not
I
resolutions. I
love that.
feel like
Mhm.
the word resolution sets me up for failure.
Always.
Goal is like I can do things to work at it.
Mhm.
So, um, yeah, just to learn more about all the fun peptides that are out there
Yeah,
was my main one.
it's very exciting. I think that health and wellness and all of those things are pretty much everybody's resolution goal for the new year. So um, we'll go ahead and get started. So this is exciting that we have a new topic and a new program to talk to you guys about. Jess here has done very extensive research in putting this all together. I know you've spent hours and hours just making sure that what we bring is the safest,
Mm-hmm.
the most effective,
Mm-hmm.
and the highest quality. So
Mm-hmm.
I'm super honored to get to talk to you about this. And I have a lot of questions myself. So
Okay.
let's go ahead and get
All right.
started. These are a few of the topics that we'll talk about today. We'll go over just the basics of what type of GLPs we offer, the type of support that we offer, microdosing, which is very interesting. I
Mm-hmm.
know you get a lot of questions on
Mm-hmm.
that.
Definitely do.
And then some of the other enhancements that we have that are also very exciting that we've kind of put together in packages for you guys to make sure that you are really assisted with the correct things along your journey. Well, my name is Emily. I have been with Synergy for many years now. I'm not going to say the number because it's in the double digits. So clearly, I love this team and I love Synergy so much. I do work in our marketing department now, and I have the pleasure of getting to do all of these fun webinars with our experts. Jess, I've known you for a few years,
Yeah.
and I've had the pleasure of watching you because you train all of our onboarding injectors, kind of watching you in that element, and that is your element. It's really, really cool to watch you
Thank you.
shape and mold our providers. So tell us a
Mm-hmm.
little bit about yourself.
So I'm a physician assistant. I've been a physician assistant since 2003. So can't believe that when I
Right.
say that. A lot of my career has been in traditional medicine. I made the pivot to aesthetics with the encouragement of my cousin, who's a PA in aesthetics in Pennsylvania. I started that in 2018. And I actually started at Synergy. I finished my fourth year. I was actually coming here as a patient and transitioned to being a provider here in aesthetics full time. And it's been a wonderful career pivot. And I thrive at this company, and I love this company because we do exactly what Emily mentioned, was provide quality care. We take really good care, comprehensive care of our patients, and we really invest in our providers. I'm very confident that our providers are some of the best and are safe and the most knowledgeable in the market.
Yeah, absolutely. And we're so honored to have you.
Thank you.
Okay, so as we mentioned,
Hmm.
Synergy is special. We have been around for 20 years. We were founded in North Carolina. We now have two locations in Virginia, which we are led by a board certified plastic surgeon, Dr. Shaw. What makes us special and what makes this new program special is kind of the mentorship that you give your patients. So
Hmm.
we'll get into that. But as you said, everyone is highly trained. I mean, it's nonstop trainings around
Hmm.
here. And because of all of the training and the expertise that we have, we are the number one provider of Botox and Juvederm in North Carolina.
Go us.
Go us. So I know that you can get GLPs on just about every street corner.
Yes.
And that's great that it's so accessible. But I know from personal experience, it's not always ideal to just
Mhm.
jump into this without some guidance. So talk a little bit about what makes this program different.
Right. So, number one, we talked about our providers. I'm confident in saying they have a lot of training, they are very comprehensive, and very safe providers. The GLP medications, a lot of patients can find these medications online. Um, there's websites that are not compounding pharmacies that you can just click, put it in your basket and buy it, and it comes to your house. There's no medical provider guidance with those medications. There's a lack of quality control with those medications as well. So even though it's saying you're getting a GLP, maybe you are, but you don't know exactly what's in there.
Yeah.
So that is kind of a struggle with, oh, it's cheaper. Well, it is, but you don't know what's in there and you
There's a
don't have any
reason.
guidance.
Yeah.
And that's where we kind of get into the situations where patients are then left to use ChatGPT or Google or other resources to help guide them with how much they should be injecting, how much they should take. And this leads to ER visits and poor side effects, and unwanted side effects, and not the best outcomes. There's also online like Roe and Hers, those platforms also make the medication accessible. There's a little bit of medical history information that you input, but again, you're not meeting one-on-one with a provider, establishing a relationship, and there's not really good, thorough medical oversight there.
Yeah.
So here, the synergy difference, you get to work with me or a couple of our other really amazing providers that we have. We get to know you. These medications, the dosing, how we approach your treatment plan is very individualized. Everyone's metabolic health is unique. What maybe works for Emily may not work for me. And that's really hard to kind of work through that over text message with someone who may be AI. We don't know. So you get that really unique, tailored treatment from Synergy providers. We also are very good at managing side effects. We provide our patients with our email to contact us. You can call us. You can even text Synergy, and your provider will get back to you. We really like to take care of the whole patient. The biggest thing, and we'll kind of transition a little bit more in the next slide to this, is where we source our medications, our GLPs and peptides from, and that is the compounding pharmacy Strive, which is a really amazing, supportive, nationally recognized compounding pharmacy. We know that our products that we order and give our patients from Strive, they go through a strict quality control process. Compounding pharmacies, legitimate compounding pharmacies, do have to abide by FDA guidelines in terms of how they function, how they make their medications, sterilization of medications, quality control. The really nice thing too is we are able to customize and tailor different dosing patients get with these medications as opposed to some other ways patients get GLP medications. We can really customize it, and patients here have tolerated these medications so well because we have that ability through Strive's products.
Yeah, it makes a huge difference. I've done it both ways. I would not recommend doing it without expert guidance. The results are night and day. And when you talk about side effects, and we'll get into that, because working with you guys, I was able to really find my dosage.
Right.
The side effects were completely gone.
Right.
And I was experiencing them so severely that I was like, I can't do this. But working with you guys, there's just so much detail that goes into taking care of us. So, yeah. Okay, well,
here we go.
Basically,
okay.
What is?
Okay, so what are GLP medications? So we all know we use semaglutide and tirzepatide. Some people pronounce it semaglutide. However, sema, TERS, however you want to pronounce it, or whatever name you want to give it. Those are two different medications. Otherwise, from brand name, big pharma are called, you hear Ozempic, you hear Wegovy, Mounjaro, Zepbound. We are able to get the active ingredient, the active medications, which is semaglutide and tirzepatide, not brand name. Every medication has two names. Um, and that happens across the board. So we are getting the generic, compounded, active medication in the otherwise known brand name medications. What the GLP medications do, they do a couple of things. So they help to stimulate insulin secretion in our bodies to help lower our blood sugar levels and keep them at a nice steady state. They help our gut and our brain talk to each other. So basically, what do they say? What's their conversation? The conversation they have is, hey, I ate half that chicken breast and a little bit of vegetables and I'm full now. I don't need to clean my plate. I'm full. So that helps decrease the amount of food that we eat. So now we have the glucose control. So we're eating our food, we're fuller quicker, we're eating less. Our body's doing a better job at breaking it down. And the way that also happens, it kind of slows our digestion a little bit. So we actively do feel fuller longer because our food kind of hangs out a little bit more in our system and doesn't kind of pass through to the small intestine as quick. The main difference, if we kind of want to talk about that, we'll touch on it real quick, between the semaglutide and tirzepatide. Tirzepatide does all of what the GLP does, but it has a little added feature, I'll call it. And that feature is it works to improve our metabolism. So tirzepatide is just a little bit of a more effective medication than semaglutide, but both are really great on their own. Mhm. Yeah, so what to expect with these medications? So the great thing is not only does it kind of help these changes with what I just described, everyone kind of finds out and is so oppressed by how these medications reduce cravings and food noise. 100% like wouldn't have believed it until I started the medication. If you're someone that like craves carbs or is thinking about snacking, that goes away.
Yeah.
It's almost freeing. A lot of my patients will tell me, you're not kind of thinking, oh, I ate a cookie, now I got to work out. Like you just kind of really are released from this food pressure. So it reduces your appetite, but also cravings. Our goal is for gradual, steady weight loss. I like to say it's a little cliche, but this is a marathon, not a sprint. We really are kind of looking for around 2 to 5 pounds of weight loss per month. This helps to maintain your lean muscle mass. It helps to prevent different things like Ozempic face, Ozempic butt. We don't want that.
Hate that.
Hate it. So a nice, slower, gradual onset of weight loss really helps to hold on to muscle mass and keep our skin nice and tight. Side effects. Everything has a side effect between, an injectable we use, medications we take. So specific to these medications, nausea, hands down, it's the most common side effect. You're going to get that a little bit more with the semaglutide than you are the tirzepatide. Some patients will get indigestion. You can have a change in your bowel movements. These are all side effects that you may or may not experience. Sometimes we experience them more when we first start these medications, and as our body kind of gets used to the medication, and you work with one of us to kind of figure out, hey, how can I improve these side effects? And this is why you come in once a month and touch base with us. Do we treat the side effects? Do we titrate the medication differently? Maybe we switch from semaglutide to tirzepatide. So your body, though, definitely adjusts to the medications. And our goal is to really have you on a dose where you're losing weight in a very healthy, gradual way, and you're not suffering from these side effects. And we can definitely get our patients there. One of the biggest parts of this weight loss journey is behavior and lifestyle modifications. This is the hardest
It
part,
is.
hands
Yep.
down.
Yep.
It's so important that we are doing resistance or weight-based exercises
Mm-hmm.
while we're on these medications. Anytime we do programs where we lose weight, we're going to lose a little bit of muscle mass. So if we're also losing weight faster, that's also more of a risk. So we want to make sure, especially depending on our age range, um, that we're getting resistance exercise in, lifting weights, at least a couple of days of the week. High protein diet,
That's huge.
huge. I'll tell my patients, you're not going to be very hungry.
Mm-hmm.
So when you do sit down, focus on the protein
Yep.
first.
Yep.
And it can be difficult, to get 100 grams of protein a day. Sometimes we'll talk about different, protein drinks that we can use.
Yep.
They digest a little bit easier. Um, and, these medications also, it kind of turns off like the want to eat something bad.
Yeah. Yep.
Right?
Definitely.
Like you're like, "No, I don't really want the junk food." Um, so yes, behavior modifications, protein in your diet, hydration is a big one,
That's it. Also, a huge
a
one.
huge one.
Mhm.
Because sometimes we aren't hungry and then we don't feel thirsty, but
Yeah.
that can take us down a road of dehydration. So I'll even tell patients set your alarm on your phone
Mm-hmm.
for like once an hour, drink some water, electrolyte water. You can put protein powder, specific ones in electrolyte water.
Yeah.
We can figure it out.
It helps a
Yeah.
lot.
Yes.
A lot.
Yeah, so we talked a little bit about these two. If any of my patients are on the webinar, you'll know that I say this. And I got this from a friend, this comparison. So when we compare semaglutide and tirzepatide, we kind of talked about the little bit of the differences already. I like to compare them to Toyota and Lexus.
Mm-hmm.
Okay, so semaglutides, Toyota, tried and true.
Yep.
Both of these are very good quality products. Um, the tirzepatides, the Lexus,
Mm-hmm.
they're both gonna get you where you want to go. The Lexus is gonna be a little bit more of a smoother ride.
Mm-hmm.
Yeah, it's gonna cost a little bit more, but it's gonna be a little bit of a smoother ride, and maybe you'll get there a little bit faster.
Yeah.
Both really great options. And this is also why a conversation, whenever you do a consult with us, to figure out what's the best one for you. And you can talk to your provider through that.
Okay, this is fun. This is
Yes.
where I am in
Okay.
my journey.
Yes.
So, and this has changed everything for me.
Microdosing.
Mhm.
Okay, so many questions. We see this on social media, whether it's medical providers, influencers, can I microdose? What is microdosing? Microdosing in its most simple form is basically taking a medication under the therapeutic or actual indicated amount and still getting benefits
Mhm.
from it. So there's a lot of different ways to microdose. And I will be transparent and say the majority of my patients, and I'm trying to think, I don't know even if I have one patient that's on the max dose or the recommended like highest dose of either of the medications. Um, so you can start out at, instead of, for example, 20 units, we can start you out at 10 units. Some patients don't just take this medication for weight loss.
Mhm.
There's so many great benefits of this medication. I have some patients where it helps with chronic inflammation and pain. I have a patient that takes it, it helps her foot pain. And
Interesting.
she's on she is even below the starting dose. Like she's taking the smallest amount, but she notices, hey, if I'm consistent with this, it's actually helping some chronic foot pain she
Wow.
has. Um, so that's one way to microdose. Another way is you can split up your dose into smaller increments. And of course, talk to your provider about this. If you're doing 20 units a week, instead, you can do 10 units twice a week.
Mhm.
So, in essence, you are microdosing because you're using smaller doses over time to get you the same result.
Yeah.
Lots of great benefits from microdosing. You can still have cravings turned off. I will say that microdosing, you're probably not going to find a lot of studies online if you do a deep dive because it's a little bit of a different way of using these medications. So definitely work with your Synergy provider to talk about this. Sometimes we have to put you on the actual recommended dose to meet your goals. And then once we get there, we kind of get you on a maintenance dose or we can microdose at that point. So it just depends on your reason for taking the medication, how you're doing on the medication, and working with one of your providers.
Yeah, I like what you said about it's not always for weight loss.
Right.
I know for me, it's more about being intentional
Mm-hmm.
with my relationship with food.
Mm-hmm.
And really, yeah, it's there are so many different ways that you can use it, and it's so exciting to see
Yeah.
how people are kind of figuring that out.
Yeah, I love it. I think microdosing is great. Managing side effects. Yeah. Biggest one is the nausea we talked about. Um, Eating smaller meals throughout the day, keeping something in your system. Um, Taking your time eating, that is a big thing too. Prioritizing protein. You're just not going to want to eat the greasy foods.
And if you do, you'll feel horrible.
Yes, I say if you do, you won't feel good. Sometimes, especially over the holidays, like, oh, I have this once a year, you eat a lot. It may not go well. Just because you may feel just kind of gross and overfull. And so for nausea, it's peppermint tea. I have little ginger chews that I've used in the past, which work amazingly well. Last resort is, we can talk to you about a prescription medication for nausea too. But you really shouldn't be that nauseated with these medications. That means on our end, we need to adjust something. Staying hydrated. Definitely, we talked about that. Electrolytes, getting good water consumption in. Fiber will definitely help. So, it's so hard, like protein, getting fiber in your diet. So there's some good supplements for fiber too, over the counter, but being mindful of that. And, just kind of titrating the dose and working with your provider is really gonna also, be open with us, talk to us, that's what we're here for. And we can definitely help you through them.
Yeah. Okay, so this is exciting.
Yeah.
This is what we have launched. So Jess, take us through the different packages that we offer and their benefits.
Yes, so this is exciting. 2026, we have added on some new products. So, of course, you can get your semaglutide and tirzepatide without a package. Although we are bundling some other wellness options with our GLP medications. One in particular, we'll start with this. So this one's really exciting. So this is our Synergy Slim Energy Renewal, right? So this will be your semaglutide or tirzepatide plus NAD plus. Probably, if you haven't seen anything about NAD plus now that you're doing this webinar, it's going to pop up on your phone.
Yep.
So yes, NAD plus is a peptide that we have in our bodies that decreases as we age. NAD plus helps with energy, it helps with focus, and it can help with metabolism. It's a really great anti-aging peptide to stack on to your GLPs if you're feeling a little fatigued, you're feeling a little foggy, you've lost a little bit of energy. I will say our medications that we get from Strive have a little bit of B12 in there to help with this. Sometimes you need a little bit more help. And has some glycine in our products as well that holds on to muscle mass. But NAD, you can get that as a nasal spray, how we're offering it, or as a sub-Q injection. This, similar to your GLPs, we start off on the lower dose and titrate up if we need to.
So the NAD plus comes in a vial and they will do once a week injection.
Yes.
Got it.
So NAD, injectable, your provider can go over the details similar to you're going to draw it up. We're going to talk to you about how to do the units. We'll teach you how to self-inject. Every patient that's nervous about self-injecting, they come in and we do the first injection together. They're like, oh, that's it?
Not
I'm
bad.
like, yes, that's it. A lot of times anticipation is worse than, the actual treatment.
Absolutely.
Yeah, so we could do nasal spray for those patients that are needle averse. It's really great. Of course, sub-Q injection, you're gonna probably feel a little bit more results than the nasal spray, but if you have a needle aversion, it's great to do the nasal spray.
Yeah, it's nice to have that option for
Yes.
sure.
All right, our next one, Synergy Slim Lux Hair Revival. A lot of patients that, are just learning about GLPs or on them, the number one concern and question I probably get from patients that want to start these medications, what's going to happen to my hair? Because as we're aging, perimenopause, menopause, our hair changes so much. Our hair thins is a whole hormonal situation going on there that this is going to be helpful. So the product that Strive, it's a vitamin. It is kind of like their Nutrafol equivalent. Okay, it has some great B vitamins, some iron. It's 2 capsules a day. Whether you want to take them both in the morning, one in the morning, one at night, easy peasy. Hair restoration is a very challenging problem. We know that because we try and help with hair loss and hair thinning here with other modalities. So the hair supplement is really good. I switched from Nutrafol to this hair supplement myself. I think it's great. Again, just like any kind of good product, you got to use it for a little bit for it to work. So don't expect,
Immediate.
immediate results right away. A little bit of patience. It's really nice to actually take this and think about our PRF treatments for hair, and we can kind of get into some complementary treatments we already offer here. All right, this one, Synergy Slim Collagen Restore. This is a combination of one of our GLP medications with a topical copper peptide. So GHKCU, that is a peptide that, again, we have naturally in our body that we have less as we age. This is a cream that you put on your face twice a day, okay? What it does is it stimulates collagen production. It helps your skin be more resilient. It gives your skin a really nice glow, and it helps strengthen our natural skin barrier. So for those patients that are concerned about Ozempic face, or just any of our patients really that want to, enhance their skin, this is a really nice product. Use it twice a day. This does have to be refrigerated, which can be a little bit different for patients with skin products. So just keep that in mind. But this is a really nice product. Yeah, so treatments here at Synergy, right? That help support weight loss.
We have quite a few.
We have a lot of good ones.
Yeah.
So don't think, hey, if I get Ozempic face or I feel like my skin's lax or I've lost volume to my face, we already have really, really great treatments to support those changes. So we can kind of talk about some laser, some injectables, RF microneedling.
RF microneedling is fantastic for collagen production and lifting and tightening. So it's your microneedling enhanced by 100. Do you see a lot of Ozempic face, do you feel like?
I don't feel like I personally do with my patients because we are slow and steady. But RF microneedling, I think patients that ask about it, they don't know the difference between medical microneedling and RF microneedling. So can you speak to that background?
So medical microneedling is just using needles to penetrate the skin for collagen induction. RF microneedling incorporates radio frequency, which is just going to put more energy in your skin, which creates a more robust collagen response. So it's just microneedling on steroids, pretty much.
Mm-hmm. Mm-hmm.
Yeah.
Yeah. Oh, this is one of my favorites.
Oh, this is a good one.
This is a good one. Sculptra. Again, if you're one of my patients, you probably, hear me talk about this. Sculptra. What is Sculptra? Sculptra is a biostimulatory filler. So by that, that means we, as the injectors here, we inject the Sculptra into your face to help your body stimulate collagen production. You can restore a little bit of volume with Sculptra. It's really great for skin tightening, right?
Yeah.
It's good for collagen production. We know for sure it can last up to 2 years, probably longer.
Yeah.
A lot of patients like Sculptra, biostimulatory filler, as opposed to an HA filler, because it's a little bit more natural. I like to say I'm kind of laying grass seed with Sculptra, but your body has to grow the grass.
Yeah.
So
Yeah.
it takes a couple of treatments. It's a little bit more of a gradual improvement. It's not immediate, but it looks really natural and pretty. So this is great for skin laxity.
It's beautiful. I've seen so many before and afters, and you're right. It does it kind of lifts everything.
Kind of tightens
Yeah.
more than, like a traditional filler where I'm using it to contour and to fill shadows.
Ooh, soft wave. I love soft wave.
We love the results of
soft wave is absolutely amazing. Yeah. So I have noticed when people have significant weight loss that the skin here
Yeah.
gets really crepey.
Yeah.
This is an amazing treatment for that. It's going to use ultrasonic energy that's going to deliver precisely into the skin where you're going to get that collagen response. So if you are needle averse, this is a great option. I do feel like this gives a little bit more of a lift than Genius. Genius is really working more on like tightening the skin, where this is really kind of going to give you a lift and maybe put that crepey skin back where it was.
Yeah. I like to explain to patients, they're like, well, should I do soft wave? Should I do Sculptra? I am limited with Sculptra of where I can inject it and help to enhance your skin and your tissue. Soft wave, we treat the whole face and the neck, which is great. So you're getting skin tightening all over your face and neck as opposed to just kind of mid face or lower face. So you're really doing more. So that's to me, that's the biggest difference. So some people, like you said, are needle averse. Soft wave's your girl.
Yeah, and it's universal. It's everybody is a candidate for soft wave. There's no downtime.
Right.
It's really an amazing treatment.
Filler. So this is where we're talking about traditional HA filler. I like to describe HA filler and Sculptra in a way that is understandable in terms of they both play on the same team. They just play at different positions, but you get the best outcome when they work together. So traditional filler, we can use that for volume restoration. We're all on this webinar because we're interested in, wellness and fat loss, but it would be great if we could just keep the fat in our face.
Yeah, exactly.
Can't do that.
Yeah, unfortunately, it's from everywhere.
Yeah. So we can use traditional HA filler really for some nice volume restoration. Sometimes patients lose the weight and maybe we use it a little bit on the jawline. We can help kind of camouflage jowling. And as we age, where our fat pads are deflating and kind of shifting anyway. So I kind of prefer, and every provider may be a little different here. I kind of prefer patients to be at their ideal or maybe their goal weight before we go ahead and do the filler treatment because it's just going to change placement, amount, and probably my recommendations. So yeah, HA filler, you see changes right away. You see the difference. So yeah.
So, can you kind of walk us through your weight loss consultations?
Yeah, so another difference, I guess, between Synergy and some other online programs or just getting your medication online is whenever you call Synergy, we're going to talk to you about, do you have blood work that's done in the past year?
Yeah.
If not, we will order those labs to be done. We find it really important to have some baseline levels. What are your kidneys doing? What's your liver doing? What's your thyroid doing?
Yeah.
So that's number one, a requirement for us to be able to start medications. A lot of patients are eligible for treatment. So, if you would go to your normal medical provider, they a lot of times use BMI as an inclusive reason why you should be taking the medication. Uh, I think BMI is a little bit of an antiquated way to measure someone's health. So I, encourage our providers here, and I think a lot of them are comfortable. You don't need a BMI of 27. You need labs that are acceptable and okay. We need to review your medical history. And if you don't have any contraindications, which are truly, if you're already on a medication for diabetes, we can't start this medication. If you have any medical conditions that are not controlled, we're not going to start something new. Medullary thyroid cancer in yourself or a family member precludes you from treatment. So those are the biggest things. So that being said, we get your medical history, we have your labs, we kind of touch base. We educate you on our medications and what that looks like, your once a month check-in with us. And then if you're good to go, what we do is we order the medication. It comes to one of our locations, depending on which provider you see. And you have an in-office appointment. We get measurements, we get your weight. And then at that point, what we also do is walk you through your medication, your little packet, how it comes. We get you comfortable with the vial, how to draw up the medication, and you inject it in the office that day. So we can make sure that you're comfortable doing that. After that, you come back in person and touch base once a month, and then the medication's delivered to your home, not here. So you have that convenience.
Yeah, yeah, it's very nice. Yeah, you are taking a risk when you purchase online, just kind of
without any of this oversight. Yes, yes, yeah.
Okay, so the offers are again a complimentary consultation with one of our wellness experts. That is normally a $100 value. And we'll be offering that through January 31st. So if you're interested at all, you want to kind of dip your toes in.
Yeah.
This is a great month to come in and just talk to somebody,
And we have providers at our Inside the Beltline location here in North Raleigh, at our Cary location, and then of course also at our Richmond and Midlothian locations too.
Yeah. Okay, let's look at some Q&As. Okay. Do you want to start from the top?
Yeah, we can do that.
It looks like, is there a sliding scale for determining how many months it will take to lose, for example, 50 pounds at the recommended dose? Question mark.
There isn't a sliding scale per se. And like I said, everyone's metabolic health is different. So, maybe the dose that you start out, you're going to lose 5 pounds the first month, but I don't lose any. So it's hard to give an actual prediction of how much weight you're going to lose in what period of time. Because everyone's just different and unique.
Yeah.
Cost
of blood work, is that just dependent on their insurance?
So when we order the labs to be done, if you need them to be done and you haven't had them already from another provider, that we order them to be done at LabCorp. So we place the order and then you can go online and schedule an appointment with any of the LabCorp locations in North Carolina and have the labs done. We always kind of associate the labs with a diagnosis. So they will always try to first submit it with your insurance for coverage. That's what LabCorp does.
Mhm.
If they, and I also think because I've had my own blood work done there, they will also, before you get your labs done, give you an approximate cost of what
Mm.
your labs are going
That's
to
nice.
be.
Yeah.
So, basically, I will say it is out of pocket to have your labs done at LabCorp when we order them, but LabCorp does try and submit with your insurance. So I can't really 100% say, how much
Yeah.
are the labs.
Yeah.
It just kind of depends, but do anticipate paying out of pocket to some degree.
Mhm. This patient recently started a GLP-1 through online.
Okay.
Would I be able to begin treatment through Synergy when I run out of that?
Yeah, so we would follow the same steps as we previously discussed for a consult. So we'd still do a consult. I actually like to see on the consult the vial or medication that you're using because the dosing can be very confusing between milliliters, milligrams, units. There's a lot of numbers going on there.
Yeah.
So once I can see, okay, you've been taking this, you've been doing well, we can definitely kind of convert you over to our program.
Yeah. I'm telling you from personal experience, it will make a huge difference, especially if you are experiencing side effects.
Mm-hmm.
Um, Fatigue was also a huge one for me, and doing the microdose option is, I have no side effects.
Right.
So
That's
that's great.
ideal.
Okay, and this person is also
Yes.
asking about microdosing.
Yes.
Is it the same cost as someone on a full high dose?
So here at Synergy, we have tiered pricing. So the answer to that would be the cost would be different.
Mhm.
So you would not be paying, depending on what your microdose amount is, assuming that it's on one of the lower ends, you're probably going to pay less than someone who is, yes, on a full or high dose. The costs will be different.
Yeah.
Mhm.
Are monthly visits required to be in person as long as you are on the medication?
The monthly visits are required. The monthly visits do convert over to virtual visits once someone is on a maintenance dose. So as we get to know each other, we kind of got the groove down. You're not feeling side effects. Maybe you've reached your goal weight. Then we can kind of go to virtual appointments.
Yeah.
Also, if you're going to be out of town one month
Yeah.
or schedules don't line up, we can do a virtual.
Yeah.
But otherwise, yes, they are in person just to continue medical oversight, make sure you're doing okay. Yeah.
Yeah. Let's see. Oh, this is a good one. How
Yeah.
long is it safe to be on the medication?
I like this question. So if you had high blood pressure and you were on a high blood pressure medication, how long would you be on the medication?
Forever.
So, um, you know, we all have some kind of metabolic dysfunction. You can be on the medication long term and it would be safe. It's a very individual decision when we're on the medication for weight loss and not for something like diabetes. So it's safe to be on the medication long term. You don't have to. Some people like to reach their goal and then come off of it. I do recommend we titrate down off of it, like we titrate it up, not because withdrawal, but because you're going to get used to being hungry again and we can kind of work through that.
Yeah.
So you can be on it for a long time. It's an individual decision.
Yeah, I think that's the beauty of our program too, is because you're taking them through how they need to be exercising, how they need to be eating. I think you can get to a point where you have gotten in the habit of that lifestyle change.
Yes.
And yeah, maybe you don't need it anymore. I kind of go on and off just depending on,
Yeah.
whatever's going on.
Right.
This patient just had a full function panel through LabCorp. Can that be used for?
Yeah, so if you've had blood work done and you can share with one of us or whoever's making the appointment for you when you reach out to us, which labs you've had done, we can kind of look over them. If there's anything missing, we can order that. So we don't have to reorder all the full blood work. Yeah, if you've had a full panel done, we can definitely use that. It just has to be within the past year.
Yeah. Yep. Does the hair supplement cause initial hair loss before hair growth?
It should not. So I think that's a question about shedding.
Mhm.
It should not do that. I know some treatments do. I think maybe
Minoxidil,
minoxidil.
yeah.
Yeah. It does not.
Yeah, well, that's amazing. Love
Mhm.
that. Once you come into the consultation, how long after the consult before we start on the medication?
Yeah, so once you come in, or typically the consultations are virtual,
Mhm.
if you decide that you want to pursue, I order the medication or your provider orders the medication. It may take anywhere from 1 to 2 weeks to get the medication. 2 weeks is a long time,
Mhm.
but 1 to 2 weeks. But once we have that medication, or sometimes even once the day we order it, we'll already make you an in-person appointment. We
Mhm.
usually give about 7 to 10 days leeway, just to make sure we have it here,
Mhm.
for your first in-person visit.
Amazing.
Yeah.
Let's see. Is there anything else that you want to go over that are maybe more frequently asked questions in the treatment room?
I don't think so. I will say that it's a personal journey
Mhm.
for everyone. So some people are looking for a long-term solution. Some people are looking for, a short-term
Mhm.
solution. This medication can be really great for patients that just can't get that last 5 pounds.
Oh, yeah.
It can be great for patients that really have a fair amount of weight to
Mhm.
lose. I encourage those patients to try the tirzepatide because
Yes.
they're going to get some weight loss a little bit faster,
Yes.
which helps motivate them and they feel good. So, it's just such an individual journey, but your providers are here to
Mhm.
help guide you through
Yeah.
it.
Just got another question. How quickly do you feel the food noise disappears? I feel like within like 12 hours for me personally.
Yeah, I think, and I tell patients from the time you give yourself the injection, I feel like it's like maybe 12 to 16 hours,
Mhm.
you're going to notice the effects of the
Mhm.
medication, whether
Mhm.
that's, oh, I just ate less than I
Yeah.
did
Yep.
yesterday, or oh, I'm full already. So it's pretty quick.
Yeah.
Um, I like to tell patients too, if you are someone who's very active and you work out and
Mhm.
you do morning workouts, and maybe you fasted before your workouts
Mhm.
before,
Mhm.
you may not be able to do that because
Yeah.
your blood sugar is staying at a lower
Yeah.
level. So you may get jittery, you may get the shakes. So I do kind of talk to my more active patients about you may want to have like an apple or a banana, it's just a little something before,
Mhm.
but you'll
Yeah.
you'll feel the effects of the medication. Sometimes you don't even really realize
No, you
it.
don't. All of a sudden, you're just like, wow, I'm so productive because
Y-
I'm not thinking about food every
Yes,
every
yes,
2
yes,
seconds.
yes.
I have noticed too that when I do the shot, I try to eat something very like lean and healthy,
Mm-hmm.
to just avoid kind of that transition.
Yeah,
You don't want to
yes.
do anything crazy. You kind of
Yeah.
want to just set yourself up for
Yeah,
things.
don't like fast all day and then take
Yeah.
your
No,
medication, and that would be great.
no.
Yeah.
Let's see. Any vitamins or
Supplements.
supplements you recommend on the tirzepatide?
Yeah, I mean, I can go down a rabbit hole with this because there's a lot of really great vitamins and supplements. As we age, we should be taking anyway.
Mhm.
Um, any kind of B vitamins really good for
Yeah.
energy. Um, Again, the NAD plus is very
Yeah.
good. Hair supplements, creatine, be selective about what kind of creatine that you take in, but that's a good one. Oh, big one. Vitamin D and
D.
K, please.
Yeah, vitamin
Even
D.
though we're in a sunny climate, a
Yeah.
lot of us have low vitamin D
Mhm.
levels. So, yeah, there's some, like I said, if you come in and talk to me, we can go down a rabbit
I was
hole
gonna say, yeah,
with this.
definitely can be covered during the
Yes,
consultation,
yes.
whatever your concerns are.
Yeah, yeah.
Okay, let's take one more. Okay, do we call our local location to make the initial online appointment? Yes, you can call your local location.
Hmm.
And if it's a location, I think there's only one location we have that we don't offer, which is Wake Forest.
Currently Wake Forest, yeah.
So yeah, we can get you to the correct location.
Hmm.
Um, yeah, definitely.
Yeah, and I just want to touch on there's a little question above. Once you have your first in-person
Mhm.
visit with your provider, yes, you will be doing the injections on your own at home once a week.
Mhm.
So that first in-person visit, we're getting your weight, you're getting your measurements, and we're teaching you how to do the self drop the medication and do the self injection just to make sure that you're able to do that at home once a
Yeah,
week.
yeah. And it is beyond
Very
easy.
easy,
Yeah,
little tiny. If
yeah.
you've had Botox, it's the same little itty bitty
Oh yeah.
needle. Hmm.
Very, very teeny. Okay. Well, we really appreciate you all joining us. Hope you learned a lot. We're very excited about this
Yeah.
wellness journey that
Yeah.
we're taking. I know I think all of this stuff has been around for years, but it's finally merging with metaesthetics,
Yes, love
and
it.
that's so exciting.
Hmm.
So thank you so much.
Thank you, everyone.
And we can't wait to see you in.
Yes.